Good morning, students. Today we are going to discuss the sternum bone. This is the flat bone which is lying vertically in the midline of anterior side of the chest wall. This bone has three parts. Upper broad portion, this is known as the manubrium, this is body, and this is xiphoid process. This bone has anterior surface and posterior surface. This manubrium is going to articulate with this body. This is known as the manubriosternal joint, which is secondary cartilaginous joint. And this xiphoid process is attached to this body through xiphisternal joint, which is primary cartilaginous joint. Now, the lateral margin of this bone is giving attachment to the anterior end of the different costal cartilages from 1st to 7. First costal cartilage is attached to the lateral margin of the manubrium. Second is attached to this junctional point of manubrium to the body, which is known as the sternal angle. So it is attached to the lateral side of this junctional point. So second costal cartilage has attachment with the manubrium as well as with the body. Then third, fourth and sixth cartilages, they are attached on the lateral side of this, that is of the body, and seventh is articulating here. So seventh is articulating at the junctional point of this xiphisternum. That is where the xiphoid process is fused with this portion. On the lateral side of this, the seventh costal cartilage is attached. Now, if we discuss the different parts of the bone, first is the manubrium. As I have told you that whole of the bone has anterior and posterior surface, so definitely the manubrium has anterior and posterior surface. It has superior border, it has lateral border, and it has inferior border. The superior border, it shows the two notches, one notch in the center, which is known as the jugular notch, and two notches are present on either side, which are known as clavicular notch, and these notches are meant for the articulation of the clavicle here to form the sternoclavicular joint. Now, inferior margin of the manubrium is going to articulate with this body portion to form the joint, that is manubriosternal joint, and this attachment is you can see the angulation is there where the manubrium and the body, they are just fusing, the fusion is happening between these two. So some you can see or you can feel the bend. So this is known as the sternal angle. And then comes the body portion. Now body is developing from the four bony parts. So these four bony parts are known as sternibri. Initially these bony parts are cartilaginous and later on they get ossified. And this xiphoid process is the lower portion. Initially it is cartilaginous and later on it gets ossified in adults. So these are the important feature. Now I have told you this is known as the sternal angle. So this sternal angle is very important landmark. So various anatomical events, they happen at this level. First important landmark is the counting of ribs can be done from this, because second costal cartilage is articulating on the lateral side of this sternal angle. So we can count the ribs from this in living. That is, when we have to see the patient, we want to palpate the chest wall, we want to count the ribs, so we can count the ribs from this side. The second costal cartilage is coming and articulating with this portion. Then third to next important point is, so this is the landmark, or it is the level of a plane which separate the superior mediastinum from the inferior mediastinum. So this is the landmark, or it is a plane which indicate that above that is the superior mediastinum and below is the inferior mediastinum. Next important thing which is happening at this level is the trachea is coming and bifurcating. Bifurcation of the trachea is happening at this level into two principal bronchi. Then comes the, you can say the ascending aorta ends here. Beginning and ending of the arch of aorta is there on the posterior side of it, and the beginning of the descending aorta, that is the next event which is happening. The next important is, this is the level of the base of the heart. That is very important. Then comes the pulmonary trunk. It divides into two pulmonary arteries just below the sternal angle. So then again it is important landmark. At this sternal angle, you can see, or the cardiac plexus is lying at this level. This is again important thing to note, that at the level of sternal angle, the cardiac plexus is present. Then at this level, at the level of sternal angle, azygous vein, it arches over the right lung and opens into the superior vena cava. So these are the few important landmarks or important anatomical events which are happening at the level of sternal angle. Now coming to the attachment, this sternum is giving origin to the some important muscles. So first we will discuss the anterior surface. On the anterior side, first we will see on the manubrium. Here the sternal head of the sternocleidomastoid muscle is getting origin. Sternocleidomastoid. Sterno means arising from sternum. Cleido means arising from clavicle. So sternocleido is the origin portion of the sternocleidomastoid is the insertion component. So sternal head of the sternocleidomastoid is getting origin from the manubrium. Then from this lateral margin of the manubrium and the body of the sternum and xiphoid process, here the pectoralis major muscle is getting origin. So this is the landmark for the pectoralis major muscle. Now coming to the posterior side. So this manubrium on the posterior side is giving origin to the sternohyoid muscle, then sternothyroid muscle is getting origin, and the lower portion of the body and xiphoid process is giving origin to the sternocostalis. Next is the important is the reflection of the anterior border of the right and left lung. So anterior border of the right lung is just attached on the side of the to the side of the midline on right side. To this, the anterior border of the right lung is related, and on the left side it is only related to the upper one or two bony components on the side of or midline of the this posterior portion of the sternum. So these are the important attachments which are present or related to the sternum. So basically all these muscles are getting origin from the sternum. Now next important is how it is different in males and females. So definitely, as we discussed in our previous lecture, that muscular impressions are very much prominent in case of male sternum, and male sternum is longer than female sternum. And second is the sternal angle. It is very much prominent in case of males than females. So these are the important sex differentiating points, that is of this bone, that how it is different in males and females. Now coming to the ossification. Now this bone is getting ossified from the basically two sternal plates on either side of the midline. Later on these sternal plates, they fuse with each other, and that fusion, it starts from cranial to caudal direction. So this is the direction of the fusion. So initially it become cartilaginous bone, and later on what is happening, the ossification centers they appear. 1 to 3 centers they appear for manubrium, and that get ossified, and later on the bone become hard. And for this 1 to 2 center for each sternibri you can see, and later on they fuses with each other. And this whole, the fusion of or ossification of the whole bone is happening by the age of 25 years. Initially it is cartilaginous, it is arising from the sternal plate, but later on, as the center of ossification they appear, they fuses with each other by the age of 25 years. And once the fusion is happening or ossification it starts, the fusion it starts from the lower end. So this is how the ossification it begins. Now when the fusion of the sternal plate is initially it is happening, so if there is any failure of the fusion of the sternal plate, it happens, it leads on to the condition that is ectopic cordis. What is happening in that case? The heart is exposed to the anterior chest wall. So it is not covered by chest wall because there is a gap here. So sternum is not fused in the center. So next is this ossification center for the xiphoid process. It appears by the age of 3 years, and it fuses or it bone or it get ossified by the age of 40 years. So this is all about the sternum, which is very simple bone. You have to remember the important things, that is what are the different parts of this bone, what are the peculiar features at sternal angle, and how the cartilages are attached to the lateral margin of the bone, and what are the important origins of the different muscles. And next is the ossification. Thank you very much. Kindly like the video if you like this class, or if you like the lecture, like it and subscribe it. Thank you very much.